Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers, in this episode, Ine dives into one of her research refreshes. She's chatting about a randomized control trial comparing two groups of dogs with Stifle injuries. They had cranial cruciate ligament rupture injuries, medial patellar luxations, and some of them had both. And it's over a 12-week period. Now, all the dogs completed a rehabilitation program with a veterinary physiotherapist, but the treatment group also followed a structured home exercise plan. And they unpacks the study's methodology. She highlights where bias might have crept in and explains the difference between statistical significance and real-world clinical impact. Now, what makes this research stand out is that it was conducted in a clinical practice setting with actual patients. The results were encouraging and have sparked some fresh ideas of how Ine now approaches exercise programs with her own cases. Today, I'd like to say a huge thank you to Marie-Louise from Atlantic Vet Namibia for a shout out on Instagram. Thank you so much, Marie-Louise. Please reach out to me on meg@onlinepethealth.com so I can gift you your limited edition veterinary rehabilitation podcast mug. Now, if you don't know already, on the 8th of November, it's our Vet Rehab Summit. We are excited to bring you a full day of expert insights, inspiration, and connection. It's all online from the comfort of your home. This year's theme is Dynamic by Design. We're going to be exploring canine and equine anatomy and motion, diving into biomechanics, muscle activation patterns, and movement science that you can apply in practice right away. Now, we've got free live tickets, but the spots are limited. So if you want to access the full lineup and all the sessions recording afterwards, you can register at vetrehabsummit.com. A quick word from our sponsor before we dive into today's topic. At Paw Prosper, we believe true pet well-being demands a three-pronged approach: prevention, support, and rehabilitation. Our brands are trusted by veterinarians, universities, and rehab facilities alike. So whether you're looking to train, rehabilitate, or help your patients age gracefully, our brands, Walking Pets, Help 'em Up, Respond Animal Therapeutics, Fit Paws, Muffins, Halo, Sleepy Pod, and Canine Cards offer effective, innovative, and proven solutions. You can sign up today to receive a one-time special gift for all our veterinary rehabilitation podcast listeners with your next order. And you can go to www.pawprosper.com/OPH. And of course, you'll also see Paw Prosper and all their brands on the 8th of November at the Vet Rehab Summit. All right, over to Ine with her research refresh.
Hi guys, and welcome to this month's Research Refresh. Today we're looking at a relatively new paper, 2024, published in the Animals Journal, The Effective Therapeutic Exercise on Body Weight Distribution, Balance, and Stifle Function in Dogs Following Stifle Injury. Right. This was a randomized controlled trial over a 12-week period where they looked at stifle injuries, and that included cranial cruciate ligament ruptures, and usually they were post-operative, as well as medial patellar ligament dysfunction. They essentially created two groups, a control and an intervention group. Both groups had rehabilitation, but one also had a progressive home exercise program. And that is the variable that they were looking to determine what the effect of was. So we know that our most common stifle injuries are to the cruciate, and then as well as patellar luxation or patellar dysfunction, and they're very common in dogs. This study was conducted in Sweden, and they share some Swedish insurance results here, which is really interesting, but I haven't included that for simplicity. The the muscles of the stifle of the hind limbs, so our large muscle groups like the quads, biceps, fem, gastrocnemius, they really require coordinated neuromuscular control. So really exact timing to deliver active stifle stability during dynamic movement. When there's reduced timing or coordination, this can increase the susceptibility to injury, and it's hypothesized that it does influence the occurrence of cruciate ligament ruptures, and we know that it's affected when the patella is luxating, right? So improving motor control mechanism is anticipated to increase dynamic joint stability, protecting the cruciate from excessive strain. Surgical treatment of the cruciate and the patella both aim to reestablish joint kinematics, resolve pain, and return the patient to full function. The majority of dogs with cruciate ligament injuries and many with patellar ligament injuries undergo surgery. Neuromuscular control of limb motion is essential. Gait abnormalities are very common in both of these groups, and so in the study, they talk about Horak's theoretical framework, right, around balance. So Horak's theoretical balance framework describes balance as a complex skill involving 6 interacting systems, all consisting of independent neurophysiological mechanisms controlling a specific aspect of postural control. So they've built this study and the therapeutic exercises in this study around these 6 domains of balance control, right? So biomechanical restraint, controlling the center of mass with respect to the base of support, stability limits, how far can the body move over its base of support before losing balance, anticipatory postural, active movement for a postural transition from one position to another, stability in gait, the evaluation of balance during gait, change of speed, head rotations, etc. Sensory orientation, so increase in body sway associated with altering visual or somatosensory information, and then postural responses, compensatory stepping responses to an external distress. Therapeutic exercise is aimed at facilitating recovery and assisting a more rapid return to function, promoting neuromusculoskeletal components of physical activity. So balance and weight-bearing exercises such as 3-legged standing are used for a wide range of conditions like OA, CCL rupture, neurological dysfunction, and are really considered important in canine rehabilitation. Okay, in addition to these components, the rehabilitation process and therapeutic exercises rely heavily on the principles of specificity and overload, and the dosage will determine the size of the effect. In general, rehabilitation programs start with low-level activities and then progressing to a higher level. All progressive loading aids healing and challenges the body to build strength. Okay, now that makes it difficult to create a protocol of therapeutic exercises and to prescribe that especially over a period such as 12 weeks, because if we do that, we can't progress, we can't create specificity and overload in accordance with the individual patient's progression through the exercises. So that's challenging, and they have actually worked with that, but it makes for a difficult methodology and difficulty in creating a high quality study. So the aim of this study was to evaluate the effect of an add-on progressive therapeutic exercise protocol on balance control and function in dogs following stifle injury compared to a standard rehabilitation program. They hypothesized that progressive therapeutic exercise decreased the difference in static body weight distribution between limbs and improved balance control, decreased pain-related disability, and improved stifle function. Okay, this was a randomized controlled clinical trial with 2 groups of consecutively recruited dogs with stifle injury. Randomization was performed with a program with a software in groups of 10. So It was the merged blocks software. All treatments and assessments were performed by one veterinary physiotherapist, and there was no blinding, so the person performing the treatments and assessments wasn't blinded, and neither were the owners blinded. I'm not 100% sure how this merged block randomization works, especially and how it's grouping into 10. But with the numbers that we have in the study, that grouping of 10 might not be great. And they also say consecutively recruited dogs with stifle injury. And when I initially read that, I heard, dogs came in and they were all assigned to group 1 from the 1st of April to the 2nd of May. And then the next group of dogs came in, and so they were placed into the second group. So I'm getting that from consecutively, but I don't think that's what they did. I would need to understand more about how this randomization procedure works and if that is actually a good way to do it. And then we know that they are not blinded. The physiotherapist performing the assessments and the treatment is not blinded, and neither are the owners, and that can absolutely bias our results. Yeah, okay, so inclusion criteria, the dogs had to be diagnosed with a stifle injury and then referred to the veterinary physiotherapist. And exclusion criteria were any other injuries affecting weight bearing on other limbs, as well as infection or a fear, anxiety, and stress level of 3 or above. The study was approved by the Animal Ethics Committee in Uppsala, Sweden, and by the University of Liverpool Research Ethics Committee. Okay, so all dogs underwent a standard rehab procedure, which included hydrotherapy, joint mobilization or joint mobility work, soft tissue treatments, and a home regimen with activity restriction and leash walking. And this was performed and evaluated regularly by a veterinary physiotherapist. I will go into their exact program in a little bit. After measuring so all the patients came in, then they took baseline measurements. This was usually 10 to 14 days after surgery for the dogs that had surgery. Only one dog in the study was conservatively managed for cruciate ligament ruptures. And most of the dogs are cruciate dogs. A smaller percentage are patellar ligaments, and then only one conservative cruciate there. Okay, and then the outcome measures were repeated at the end of 12 weeks. The treatment group received a home exercise program that they performed twice daily. It was really 2 exercises performed twice daily. It took 5 to 10 minutes per session, and they were given instruction from a veterinary physiotherapist with a written copy of the program. This 12-week protocol included 4 different levels that were based on 3-legged standing, developed to address the 6 systems of balance control that we spoke about in the introduction. So they looked at biomechanical restraints, 4-legged to 3-legged and 2-legged stances, repetitive weight shifting, anticipatory postural adjustments. They looked at 4-legged to 3-legged and 2-legged stances with repetitive weight shifting, postural responses, weight shifting, 3-legged stance with push, sensory orientation, standing on unstable surfaces and inclines, stability limits, weight shifting, 3-legged stance with push, and stability in gait, addressed using a standard rehabilitation protocol with hydrotherapy and controlled leash walking. Okay, so the outcome measures that they looked at, they collected demographic data, so all the normal things, and then also weight, body condition score, and muscle condition scoring. And then they looked at body weight distribution on a companion stance analyzer, right, with the dog in a square stance, head and eyes forward towards the owner. They repeated 10 recordings and then looked at that mean proportion of total body weight for each hind limb. Then they performed a balance control test. This they did in static standing, with the difference, looking at the difference in mediolateral sway between the hind legs while in a 3-legged stance position. So they have the dog standing as balanced as possible with head and eyes focused forward at the handler, each hind limb lifted in position for 5 seconds. They record video as they're doing this with the markers on the dogs, and then they measure, as far as I can understand, they measure how far that midpoint is moving or swaying mediolaterally, right? So this balance control, this picture demonstrates photos from the video recording and measurements that they performed while first in a baseline position with four-leg stance just before lifting the limb, and then with the limb in a three-legged standing position with the hind limb lifted, showing that mediolateral movement from the baseline position. They also used the canine brief pain inventory to assess the interference of pain with the dog's function. The CBPI detects changes in the impact of pain on function in dogs with osteoarthritis. It is validated and quantifiable, and it is really based on the owner's perceptions and observations, right? So this is where owner bias can absolutely have an influence. They also used the Finnish Canine Stifle Index, which I still think of as new, and this is used to measure stifle functionality as a testing battery with 8 items divided into active, so compensations in positions of sitting and lying, and symmetry of thrust of hind limbs getting up from positions of sitting and lying, and then passive, so the assessment of muscle symmetry, measurements of symmetry in static weight bearing between hind limbs using bathroom scales, and measured flexion and extension of the stifle joint using a goniometer. So active and passive components are used to quantify the level of the dog's stifle function. If you want to learn more about the Finnish Canine Stifle Index, or FCSI, we have a research refresh on it. You can search for that in your members portal and have a little look. Okay, so there was no significant difference between groups at baseline, but at 12 weeks, all right, so they had 26 dogs in the end, 14 dogs in the intervention group and 12 dogs in the control group. This is how they were randomized and allocated. They started off with 18 in the intervention group, then lost a few along the way. And in the control group, they started with 15 and then lost a couple along the way. Okay, body weight distribution was improved in both groups with greater improvement in the intervention group. So if we look at this little graph, it shows us the baseline measurements in blue in the intervention group on the left and the control group on the right. Okay, so our control group had rehabilitation only and the intervention group had rehabilitation plus a home exercise program. And we can see that after 12 weeks, there is a difference in where the body weight is distributed, right? So there's a much smaller distribution of weight in our treatment group, which is positive. Okay, and that was just statistically significant. Okay, if we look at balance, they're pretty much the same between groups. So I would say that looks quite significantly different to me at baseline, but very similar at 12 weeks. Remembering that the test that they used to measure balance was not validated. So, yeah, results for the canine brief pain inventory, there was an improvement in our intervention group. There was an improvement in both groups, but the intervention group had a far larger improvement. And I mean, this is a very big difference between the two groups. And even with the owner bias added in, so remember our owners are fully aware that they're doing something more that is supposed to make a difference and improve how their dog's function is and how they're feeling. So we have to take that into account when we're reading this. The owner expects that their dogs are going to be doing a lot better. But even taking that into account, that is really positive. Sometimes we want our owners to feel like they are doing something more that is going to have a huge impact. And when they perceive that to be true, then it becomes the truth for the dog and for the owner, and then we can have a very positive environment where we can continue to have positive change. So I think this is positive even with owner bias added in, but we need to have that in the back of our minds when we're considering this. Okay, and then for the Finnish canine, Stifle index, right? Again, there was a statistically significant difference between the two groups. Both of them improved over the 12-week period, but the function of the home exercise group improved much more than the physiotherapy only group. So again, very positive, but here we again have, the tester's bias influencing the results potentially. So we need to remember that and keep that in the back of our minds. Okay, so in conclusion, both control and intervention groups improved over a 12-week period. There was no difference in balance control, but they did not use a validated measurement method. The study aligns with previous studies that have shown the beneficial effect of rehabilitation following cruciate ligament repair, but it adds that additional layer of adding a home exercise program to that 12-week rehab period. Really importantly, and they highlight this quite strongly in the paper, but any exercise program must follow the principles of exercise. It needs to be specific to the goals that are being achieved, specific to the functional work that they're trying to achieve or work towards. It needs to apply the overload principle, and there must be progression, right? So exercise programs can't be generalized without individual assessment and reassessment of the patients. We can't create one 6 or 12-week exercise program and then prescribe that to every patient with cruciate ligament rupture post-op. We need to be able to make adjustments according to the tissue healing of the individual, the strength that's available, the functional ability of the patient, and the ability of the client as well. Okay, and then we need to also remember the difference between statistical significance or a significant effect and a clinical effect or a clinically significant effect. And what that means, I've actually been re-listening to one of Auntie's research refreshers in our members portal, but essentially an intervention can be proven effective, all right? So let's say you have a fracture and you have a 10 out of 10 degree of pain. And Panado is shown to be effective. It reduces pain by an average of 1 to 2 scores. So is that a clinically significant effect if you can take your pain level from a 10 and bring it down to a 9? No, it really isn't. You will, as a patient or as a client, become very frustrated with that degree of clinical significance. You want something that's going to take that 10 and bring it down to a 4. The trick is we are often combining things that have a smaller clinical significance, and then we're combining them together to have a larger clinical effect. And that's great. That's perfect, right? And so in this paper, they actually say that this is a significant clinical effect, but I'm not 100% sure or convinced by what they have reported here. I would love to see this repeated. I think it's positive. It definitely gives me a little bit more of a foot to stand on when I want to assign my patients a home exercise program. It gives me a little bit more in my own back pocket to feel, yes, we are going to do this. It is going to have a positive effect, and that's fantastic. But I'd like to see more research duplicating these results before we really say, and then we need to compare, right? Where is the best clinical effect? Is it in the rehabilitation program or is it in the home exercise program? And what, etc. It becomes a long laundry list. Okay. So the limitations, I would say, are significant because even though this is a randomized controlled clinical trial, There was no blinding of either the assessors or the owners. And now, how on earth do you blind people to, a therapeutic exercise intervention? I'm not sure. I don't have those answers, but blinding is very important. And you can have a blinded individual doing, at minimum, the assessments or the measurements at baseline and at 12 weeks, especially because there were only two assessments at baseline and at 12 weeks. An external assessor could absolutely have done that. They did not control for any interventions like the use of NSAIDs. Now, obviously, these dogs would have been on pain control post-operatively, but no mention is made of that, and it wasn't controlled for. What I do like is that this reflects clinical practice, because it is clinical practice. And so the results apply to clinical practice. But it's not the correct way for us to always conduct research, and that would be a limitation. Okay, I think it's positive to have real life scenarios. I think it's positive to have situations studied that actually reflect clinical practice, but the proper researchers don't always agree on that. And then this is still a small sample size, and we want to also be taking this information and extending it into a longer time period, especially when we're looking at something like cruciate ligament ruptures. What is the rate? Is this affecting, that contralateral stifle rupture? Is it affecting the occurrence of that at all? So it would be great if they can follow up with these patients in a year or so. And then I know you guys want to see what they actually included in the exercise program. So I'm going to pull the paper in here and we can have a look at that. Okay, so Appendix A looks at the standard rehabilitation protocol for stifle injury. They had hydrotherapy in the underwater treadmill. They had joint mobility, active and passive range of motion to promote quality of movement, soft tissue treatment with various massage techniques, including trigger point therapy, myofascial release, reflex inhibition, etc., as needed. Okay, so they're treating the patients as the individuals that they are. And then the home regimen with activity restrictions, essentially adjusting the home environment, having the dog on non-slip surfaces in a limited area where they cannot jump or run, and they should not be allowed on stairs. Try to stimulate them mentally and reduce food intake so the dog does not gain weight while under activity restrictions. Leash walking included short leash walks for 5 to 10 minutes multiple times a day, walking at a slow pace, focusing on weight bearing on all 4 limbs and progressing according to a functional level of assessment. Right, and then their Appendix B is the home exercise protocol. The protocol is based on 2 exercises to be performed 2 times daily, including 4 levels and progressing from less challenging to more challenging according to the individual functional level at assessment determined by the vet physio. So progression within each exercise occurs by increasing the number of repetitions, sets, or increasing the length of time per repetition. They had basic criteria for progression. Level 1, there's our pictures, they're a bit offset. So a 3-legged stand, repeatedly lifting each limb. Criteria for progression are basic. So essentially just going around lifting each limb. 4-legged standing with rhythmic stabilization in the mediolateral and craniocaudal directions, and then a photo demonstrating that. And then level 2, 3-legged standing with lateral push for resistance. So repeatedly lifting each limb. So that's what that looked like. So they would lift a forelimb, and then they would lift the left forelimb and then provide a lateral push from the right, and then the same thing with the hind legs. So lift and then push, lift and destabilize. Then 3-legged standing with the forelimbs elevated. So repeatedly lifting each limb with the forelimbs raised. Level 3, adding that unstable surface with a 3-legged stand. Okay. And two-legged stance lifting diagonally. So yeah, two-legged diagonal lift. Level 4, three-legged stance with forelimbs elevated and the hind limbs on a soft, unstable surface. Yes. And two-legged stance with the fore and hind limbs on soft, unstable surfaces. Okay. So exercises that really follow on from each other so that it remains really simple and easy for the owner to be performing. These exercises are specific to challenging the balance system of the dogs, right? So I do find the ones that they chose interesting. They've really focused in on the balance system and not so much on other functional components of neuromuscular control of the stifle during dynamic movement. We're only working on stability here. So that's something, and that's definitely something that should be looked at in future papers. But for now, this is a great beginning, and this is a user-friendly exercise program to share with owners as well. All right, guys, let me know what you think. I'd love to hear your thoughts. Thank you so much.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paw Prosper. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out at pawprosper.com. Don't forget to bookmark the next Vet Rehab Summit on Saturday, the 8th of November, 2025. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.